Okay, guys, so welcome to the Crypto, Capital, and AI podcast, where I talk to the sharpest minds behind the future. I'm your host, David Simic. Today I'm joined by Mwombeki Fabian. He's a founder, investor, operator who's worked in a bunch of stuff, touching upon crypto and AI and medical technology. Welcome, Fabian.
Thank you so much, David. It's always a pleasure to talk to you. I know we've been touching base now and then for many years, and I'm glad to be on the podcast. Thank you so much for the invitation.
Yeah, thanks for joining. So, Mwombek, can you tell us a little bit about? I know you started out as a medical doctor in Tanzania. Now you're located in San Francisco, and between now and then, a lot has happened. And you actually made the decision early to switch from medicine to tech. Can you walk us through that? That's very interesting and unusual.
Hey, man, I don't know where to start. So you're very right, and I think that was our connection when we met first time, MedTech, and how we can explore and take advantage of what we two of us kind of were interested in. Yes, so I trained as a medical doctor in Tanzania. But before I went to medical school, I had an interest in technology. I had worked in an IT company, was a startup internet company. So we did everything back then, read cables and configured servers. And I remember Napster coming in and we will even help people
Getting
like,
next.
this is Napster.
Yeah,
Yeah, people wanted to know if they can
yeah,
have all the music they cannot afford and stuff. So it's cool.
yeah.
So that was my interest before I went to medical school.
So I actually don't. I mean, I remember Napster. I just don't remember like roughly what year was that. Do you remember?
So
Um,
I don't know if I really kind of like figured Napster when it was starting. Maybe it was when it was at peak or when it was becoming
yeah.
so popular. And I think that was like the year 2002, 3, 4, around that time.
Right. Yeah, yeah, yeah.
Yes.
Not the '90s when it was like really just basic HTML, but around the time I guess when Google was kind of taking off and like yeah, some other
Yeah.
services. Yeah,
Yeah. So
yeah.
I remember, so the internet company that I used to work with was on dial-up back then. And then we had brought in a new technology on radios and stuff. And people were like, oh, no, now you can do cool stuff. People wanted to see how they can use Skype. I remember people wanted to see how Napster is and stuff like. So it was really cool to do things like those.
Yeah.
And I just came out of like high school, and there was this interest of what technologies. You really want to know everything that you have never seen when you hear about Linux servers and stuff. So like I had really got an exposure on the technology, on the internet piece. And then when I went, I really wanted to become a doctor. And so when I went to medical school, the technology piece was always calling me. So during my schooling, I'll go back and ask this company, hey, can I just volunteer and do some of this cool stuff? So I started picking up some small things, and I remember like they allowed me to learn Pascal programming. They had like a
Hmm.
small software on the side. Yeah, so that was like my interest and how I plugged in technology after or during the
I
time when I
remember
was in med school.
Pascal too. Yeah, yeah. I
Yeah.
didn't program a lot in Pascal, but I think my first
Mhm.
experiences were kind of like Visual Basic, then like some kind of applets in Pascal, like roughly all around in that same early period. Yeah.
Yeah,
Interesting.
yeah. So it was cool, to be honest. Yeah. So when I went to med school, 5 years training, 1 year internship, and then had to work for a year plus. I always had that feeling like, how can I exploit my technology background? So I
Hmm.
was looking for my next move. Let me look for a graduate school that could bridge the two. And I applied for a school. I remember Karolinska. In Sweden. I'm like, I really want to go there. They had a program in health informatics, and they
Hmm.
were trying to train medical graduates to actually understand technology and deploy it in healthcare. And then at the same time, Duke on the US side had a program in clinical informatics at the business school. So they
Hmm.
had said, no, we want to bring in medical experts and medical graduates and IT graduates and give them a business training, but at the same time, like ingrain them in how they can use technology and to push all these ideas around clinical efficiency, clinical operations. So when
Hmm.
I looked at the two programs, I was like, no, I'm going to Duke. Yeah, I was like, Duke would be cool. I'll have the business training, which I didn't have back then. And I'm like, I'll really meet these guys who are hardcore in programming. And back then, I think Duke had a really good reputation around like engineering. And I thought, I don't know, I'm gonna get some guys also doing engineering, and maybe software engineers will be there as well. So that was like my push coming from Tanzania to move to US and try to learn clinical informatics. So I
Hmm.
think that answers the question that you asked me, like how did I move from
Yeah.
medicine to
Well, it was just really interesting that, kind of, I actually met a lot of the doctors who are kind of technology, like it's clear that they had like another interest, and they're a little bit maybe almost like, oh, I wish I had, done this other thing. But most of them like end up staying in medicine. What was kind of like, was it kind of like a moment or a trigger where it's like, oh, I prefer not to deal so much with patients. I prefer to kind of focus more on this technology stuff. Um, like, was there a
uh,
moment for you, or like some kind of, or just kind of like a feeling and you just followed it?
I think it was more of a feeling. Like I really like the fast pace of technology,
Hmm.
and especially I remember when I came out of Duke, the grad school back then. That's when Obamacare was like picking pace, and everyone wanted to do something. All hospitals were trying to move from paper to electronic, and then we had ideas like everyone is looking into, oh, how can I do something cool in medicine using technology. So I was like, maybe this landscape is going to change really fast for me. And I love that idea of seeing changes and being part of it. And I had not really practiced medicine for a long time. I think I had like 3 years of post-graduation practice.
Hmm.
So maybe I hadn't really explored enough of medicine, but I really loved the idea that technology was changing in the medical field, and maybe this could be something really cool that I want to be part of. So it became natural, honestly. It became natural for me to stay in the field. Yeah.
Mm, yeah, yeah.
Yes.
And what was that period after that like? Because I know when I met you, you had already finished your epoch at like Duke and kind of in that part of the United States, and you were back in Tanzania, and you had like 10 different little businesses, and including like a tech startup, and like
Yeah.
you were running like a pharmacy. Like we were thinking of setting up like a clinic with an MRI scanner on top of
Yes.
our cloud-based radiology system, and you
Yeah.
even had like a honey farm.
Oh man, so I think like just to when I go back and remember, so this was the problem that I was facing back then, and this is how we met. I know you remember it very well, but maybe I have some details that I can add in. So back then, like after I left Duke, I had worked for a hospital in Georgia as a clinical informatics manager, and we had deployed all this big system. And part of the problem that I had seen was they really had imaging services, but they did not have full-time radiologists. And I think, if I'm not mistaken, we used to use a service where we had these radiologists reading from Australia and stuff like that.
Mhm.
So I was like, oh, this is really cool, and I think it can actually work in Tanzania or in other areas where you can set up a service and then use the expertise from different angles. So when I left that hospital, I went to work for Deloitte as a consultant in technology and life sciences, and it was the same problem. So we work with hospitals. Some of them will be deploying medical systems, or they're trying to consolidate their medical software. And you'd see there's a disparity between having a system on site and having an expert. Those are two different things. So
Mhm.
the same problems were seen during my practice, during my time at Deloitte. When I went back to Tanzania, I used to do like a back and forth time. Now back to Tanzania, I started a software company, and I went through all the hospitals that I knew, and I realized the same challenges were there. Some of them could afford having MRIs, and some of them could not afford. After putting an MRI, they could not afford having an experienced or smart radiologist to hire because they're very few, and this is clear a clear picture everywhere. So that's when I started a program. Like, okay, I'm going to set up a teleradiology system, and then I'm going to connect all these hospitals and fund the experts who can actually read for them. But in the moment of setting that system, I had so many challenges. My programming was not solid. I was facing all the problems,
Yeah.
and I started Googling online, like, who can help me, which channel? And then I think I saw that you had written a really wonderful blog post about one of the challenges of moving all these massive images using 3G. And I was like, oh, this guy really is addressing a problem that I can
Yeah.
reach out to. And
Yeah.
then I emailed you, and then,
Yeah.
okay, so.
Yeah, yeah, I remember
The
getting
rest
that.
is
I
history.
remember that getting that email. Didn't know you at all, but I was curious, and we set up a meet, and the rest is kind of history. But that blog was just kind of funny because it was out of my own frustration of I had no background in medicine. I was a physicist by training, then a quant, finance and stuff like that. But for some crazy idea, I started like working in kind of helping radiologists move images around, and with the idea of building like an AI system.
Yeah.
And that blog was just like my frustrations of like all the like debugging of all the annoying like little problems with some of the open source solutions that existed there then.
Mhm.
But then it ended up connecting us. So that was pretty awesome. Yeah.
Yeah.
I think like one just to kind of add some color to the kind of you can have a system, but then is different from having the person in house. For people who are like outside of medicine, this is something that I kind of like didn't know, even though I should have known it. A radiologist
Hmm.
is actually like a real doctor first, like it's a real doctor who does a
Yeah.
lot of studying, and then they do a specialization to be a lot more studying. It's like becoming a
Yes.
cardiologist or something, right? It's like very long. And
Mm.
so obviously these people like are going to be very well paid. They're very specialized. They're very cultured.
Hmm.
They're not going to want to live in like, for the most part, it's going to be hard to find them in just like random places where you need them,
Yes.
right?
Yes. Yes.
They're going to want to usually
Yeah.
be in the capitals of major capitals of countries or major cities in countries.
Hmm.
And um, so yeah, like just to give a little context on that. So like many
Yeah.
hospitals were struggling to get their images read because like anyone can
Hmm.
buy an MRI, right? You can even buy them maybe with loans and stuff like that. Um, but getting the person to live there is another thing.
Stuff. Yeah, and I think that's the challenge of if you have scarce resources that are tried to be spread out everywhere, then those resources will find their common ground where they can actually feel utilized effectively. And radiologists are, like you say, they're very well trained or super trained, and they chose radiology for a reason. They don't really want to go work somewhere where the services are not there. That's number one. But at the same time, they have to balance between what they really want as specialized doctors. But most of them don't really care where the images are taken from. If images are coming from very far away, if they can read the image, it's fine. But they
Hmm.
wouldn't like to commute, spend an half an hour, 1 hour on the road just chasing another image elsewhere. So the business kind of made sense that we can actually bring images to where they are. And then I think our biggest challenge, if you remember, was that now with the given infrastructure and the internet, can we really transfer a radiology quality image that can actually provide the diagnosis that the radiologist wanted? And I think that's where we're struggling. How much do you compress? How much do you decompress? And what
Mm.
kind of a viewer can actually give you the clarity that the radiologist can provide that service?
Mm.
Yeah, and I think we tried our best. We tried our best and set up the system,
Yep.
and we yes, yeah.
Yeah, we had quite an adventure after that because
Mhm.
yeah, yeah. Maybe you can tell people a little bit about that because it was
Oh yeah,
yeah,
so I remember like we started with one hospital, one orthopedic hospital in Dar es Salaam in Tanzania. We set them up. We had their on-premise system where they're processing so many images. I think I remember at the height of our processing, maybe we're doing around like 10,000 studies per month for them, X-rays, CT, MRI, and we even hooked up the ultrasounds. And then after that, I think we expanded with some other hospitals and local clinics in the country, and we
yeah,
participated in the remember the
yeah,
remember the
yeah.
IFC challenge. We're trying to
Yeah, we
bring
won
our
a
services.
major, I mean like a pretty important grant to expand to like
Yes.
3 or 4 countries in the region.
Yeah.
Yeah. And we
So
had
we,
most of the market share in Tanzania at one point, right?
yeah.
Yeah.
Yeah, and then we moved to Ethiopia, we moved to Kenya, yeah, all those hospitals. Yeah, that was
Yeah.
really pretty interesting. Yeah.
Yeah, it was really cool collaboration. So
Mm.
so like basically like for the audience, like we had this teleradiology platform that was actually global. It was in East Africa. We had an American client. We had clients all over Latin America, all in the same infrastructure. Um, Getting all these images from all these different places and clinics, and then we had radiologists reading them. Um, but we were kind of like the intermediary. We didn't have our own. like there are teleradiology businesses where they hire the radiologists as salaried employees, and then they take, the company takes the cut. We were more just the software layer.
The
Um,
software layer.
yeah. Uh, so that was really cool.
That's
Yeah.
cool. Yeah.
And we even
I
had
mean,
we were implementing some AI modules and stuff like that.
yes, and
Yeah.
you remember when COVID came in and we were like, no, we need to do an auto reading for all the COVID X-rays that we have and that are coming in.
Yeah.
How much can we really help and provide like a
Hmm.
classification on the images and stuff? Yeah, that was really very, very
Yeah, yeah, I
cool.
remember debugging some of those cases and seeing like scans of lungs. And again, I have
Yeah,
no medical experience, but sometimes you can tell obviously there's something going on.
yeah.
Like you see this cloud and where the lung should be.
Mhm.
Um, yeah, yeah. I remember one
Yeah,
time I was debugging a study of a patient in Africa who came in for some reason, and I was looking at it and I was like, okay, I know what the reason is, because it's like, like you could see like the leg had a major trauma. So like kind of
major
crazy.
trauma. Yeah,
Yeah,
yeah. And I still agree with you, David. Like back then, so being a software layer really have its advantages, but also has its own disadvantage. That if you really want to provide like quality imaging, you remember when we were talking about establishing our own like a radiology center,
yeah,
buy our own MRI, buy on site, make sure the image is of high quality, and then send them to radiologists. Because sometimes like people buy outdated equipment,
yeah.
and then at the end of the day, because the radiologist is using a software to read, they feel like, oh, maybe the software has an issue, but not really. Like if you have control of the whole supply chain, like you know the quality of the images that are produced, you know the software that is actually transmitting, and you trust the viewer that actually the radiologist is using. And we're like, no, maybe this could be a really good business model back then.
Yeah, yeah, yeah.
So yeah,
Yeah, that was
that's
good. Yeah, for the audience, like me and Mobek actually, we pitched this to Y Combinator. We got to the final round, met with the
yes.
partners. Unfortunately, like they didn't go through with it, but it was also kind of incredible because like we put together the whole proposal like 1 week before, and it was just out of the blue.
Yeah.
Like, hey, let's just do this, and it was during the pandemic. It was really really cool, and yeah, like processing so many images and knowing that there were real people behind that getting helped. Very
Yes.
cool.
It's really
Yeah.
very
What were those
interesting.
some of the kind of biggest challenges, I guess, that you've seen in this space? Because there were quite a
So
few.
yeah, I think I remember like when we started. So the idea of us having very good hardware to actually, if you want to do on-premise installation, then you need to have like a really good hardware. And you remember at the beginning of we were struggling between what you can find locally and what you can import. So it
Yeah.
becomes this lag of how do you buy your hardware in Europe? Do you buy them in US? Do
Oh
you buy
yeah.
them in Asia? And how do you really ship them and make sure they have high quality? So that was like one of the challenges.
Yeah, that was actually I forgot about that because like I remember we
Yeah,
had to set up like
yeah,
accounts, business
yeah,
accounts
the
with like
reading. You remember
FedEx,
the
DHL.
reading site we were doing, and we had set up that at FedEx. Yes.
Yeah, and then getting the discounts because everything's so massively overpriced that it actually breaks the business model for the shipping. So you get like a 70 or 80% discount on that. And then
Yes.
there are like regulations like, oh, you have to like if you don't put the right thing about the battery or whatever, like you get rejected.
Yes.
And
You
then
get
there's the
rejected.
import tax, which can also break your business model.
Business, yeah.
Yeah, yeah, that was nuts. Because I thought, I mean, I was thinking like, oh, we can just ship like $1,000, like, just some Linux machine. It's powerful enough, but it's like, no, there's a lot of stuff involved.
Yeah, there's a lot of stuff going on. Yeah, we
Yeah.
became masters of import and export,
Yeah.
just trying to understand the labeling that is supposed to be right, all
From
the
from
taxes
Brooklyn,
and
because I was like buying the stuff, getting it in Brooklyn in my apartment, and then I was shipping it to Tanzania
and FedEx, and then I'll
and
collect them off.
Ethiopia and Kenya. Yeah, yeah. Yeah. Yeah, yeah, that was nuts.
Yeah, but yeah, so I think that was one of the biggest challenge, and I remember we were able to solve that, like understand how to do it in bulk, ship once instead of shipping in small items, and then you have everything in place.
Right, because like
Yes,
there was this feature where you can put multiple packages, and oh yeah, and then there were crates, and then there were like, you can
yes,
go
and then it
bigger and
becomes
bigger from there.
bigger
Yeah,
and
yeah,
bigger, and becomes effective and much cheaper. Yeah, I
yeah.
think that was like the first challenge that I remember, and the other challenge you remember we were trying to solve, I think, was around connectivity. that these radiologists, some of them want to read from home. They don't have home internet, and how can we really make the images be clear on like on 3G? It wasn't even 4G back then, or some parts did not have 4G.
Yeah.
So remember, you're looking into how can we do like a proper compression, decompression technology that is going to be useful.
Yeah, so
Uh,
yeah, they give more people context on that because like it's very specialized. Medical images can be quite heavy. Like I remember if you have like a thin slice CT scan or MRI, they have like
mhm.
multiple different views of the patient's body, and it can be like gigabytes and gigabytes of data.
Yes.
Um, and mammograms can be even like heavier. So I think
Yeah,
like
it can
I
be much
remember they were
heavier.
like 10 gigabytes, sometimes 50 gigabytes or something like crazy like that. And you're trying to push this all through like a 2 megabyte per second connection sometimes in a reliable way, right?
Yes.
Um, so there was some engineering, and you can't lose image quality. Like so, you can do
Yes.
compression, but you can't do lossless. You can't do
Yeah.
lossful compression. It has to be lossless.
Yeah.
So
Yeah.
yeah, that was fun. That was interesting. I
Well,
enjoyed working on
interesting to do, yeah. And I think so. The other last, I think the other last challenge that we had was around long-term storage. Like now, how much of these images can you store?
it.
How much should we actually have like a network assisted storage, and how much can we move on the cloud?
Yeah.
If we do, then upload and download in order to provide care. How do we define that? How many months of storage are supposed to be on premise? And yeah, so those were some of the cool challenges we faced
Yeah,
when
and
we
less cool
really,
challenge, which was around regulations, which is that just because you're HIPAA compliant in the
yes,
U.S. doesn't mean that Tanzania or Kenya or Ethiopian governments are okay with
yeah,
that, and they're not okay
mhm,
with using ADOES, and so
yeah,
yeah,
yeah.
that
And then
was
so
tricky.
and then you compare. You remember when you're comparing what AWS will offer you for cloud and what you get local in terms of storage, and you realize like if you use the local storage, cloud storage is so expensive in such a way. If you transfer that cost to the user, then your business model fails because you're trying to solve a problem of many people who don't have means. So your
Mhm.
services are supposed to be cheaper. Now all of a sudden you have an expensive storage cost that you don't know how to address that because when you pass it to the patient, now all of a sudden having an MRI that is done and read and becomes almost impossible. I remember that, and you're like, oh, but these are local regulations. They don't want any medical data to be stored outside the borders of the country, so you have
Mm.
to use the local cloud. But when you do that, your costs are actually three times, four times what you could get
Yeah,
elsewhere.
yeah.
And
I
then,
I think this is what people who haven't lived in outside of like U.S. and Europe and kind of these kind of
mhm,
super efficient capitalist countries probably don't understand because it was surprising to me when I moved to Colombia, or I think this experience is similar in Tanzania. Things are actually more expensive in those countries. Like like to get a cloud provider, a local Colombian cloud provider, where the GDP is like such a small fraction of the United States, it's actually like you have to pay like 2 or 3 times the cost for worse service. And
mhm.
similar, like when we were quoting in these the Tanzanian like cloud providers, it was like so much more expensive than AWS without any of the same
Yes,
guarantees.
yes. And I remember like when we tried to do like they did not have like SSD for the storage.
Mm.
The upload download I think was like maxed at 1 Mbps or something like that.
Something with like a 1 gigabyte per month cap or something like.
Yeah, so it was like, but we're doing imaging. Imaging is like a really data intensive process. There's no way you can cap me at such a low level. And they don't know if you want to, can give you if you bust your plan, then you can pay more. Now, if you tell me to pay more, it becomes more and more expensive.
Yeah, yeah,
Uh,
yeah. That's always something
so
that's surprising to me because, like, oftentimes you consider places like Tanzania, or you look at like the price of a lunch and it's super cheap. You look at the price of like getting your car fixed, it's super cheap. Like, but when it comes to these things that are kind of like technological or imported, like sometimes they can be very expensive compared
very
to like a
expensive,
place like
yeah.
the United States. Yeah.
And things are changing, but not so fast as you'd want them to be. Or like some of the some like what we were trying to do, if like we could actually get in good infrastructure locally, it will actually make much more sense. But
Mhm.
with cost of infrastructure and data and stuff, that it was more than expensive to actually do it. And
Mhm.
it was a challenge, but it was quite really good.
Yeah, it's quite good, and our systems are still being used by those hospitals, even
Oh
though
yes.
we're not making any charging them anything for
Uh,
it.
Still being used, like on-premise installations are still running and
Yeah,
having patients. The cloud piece, we hope maybe when infrastructure kind of becomes cheaper, maybe it
yeah,
will be
yeah,
something we can explore. But
yeah,
yes, there's still big
yeah.
challenges to overcome.
Yeah, yeah. I think it's
So,
worth revisiting at some point. Like we still have the tech stack; it's still running. There's still people using it.
mhm,
Um, yeah, it was just like I think we didn't find like the right like business model really
mhm,
to really kind of stick it out
and
you know,
expand. Yeah.
and expand. Yeah, yeah, yeah. Cool.
Yeah.
And how about after that? Like I also like I know you had some like crypto stuff going on at some point,
Oh
some other
yes,
stuff,
yes.
and like.
So yeah, so like I remember around that time when you're talking about the business model and like how do you really help someone who wants to have a second opinion about their image? Like
Mhm.
let's say they're ready to pay, how do you collect that money? Someone wants to pay two, three, four, $5, but they don't want to go through the bureaucracy of going back to the hospital, opening a file and paying and then just waiting. They were thinking, oh, maybe you can provide that service. And then I think that's when the time were like, oh, maybe there's a way for us to actually help people who want to do small payments. If someone wants to send money to David or they want to send money to me and it's a small amount, but how actually do you do it? And I think that's the time that we started thinking of fintech. Yeah, like I remember like first time when I heard about Bitcoins, I bought actually a few percentage of a Bitcoin back then. I think it was around $400 when a Bitcoin was 400.
Oof, oof, oof.
Yeah, and I wish I'd bought many, David. I didn't get
Of
10 or
course, yeah,
20 of those.
yeah,
So, so
yeah.
was interested in crypto. I'm like, let me understand. So I just bought some, like, some Ethereum, some Bitcoins that I had purchased, reading the paper and trying to understand what's the hype around this new technology that is out there. Yeah. Getting on Coinbase, opening my account, and actually just trying to see what other people are doing. So I have been. So I've been on crypto as a user, on the cryptocurrency side. I've read a little bit about like the ledger technology and how it can do stuff, and I've been following through how different technologies and different people are doing it. And it's something that's really, really interesting. And I think you remember like when I was telling you about people who really want to transfer money. You want to send $10 to someone somewhere, and then the it becomes really hard for them to cash out
Mhm.
because they have to have an ID or they have to go to a registered vendor or bank, and it becomes cumbersome. And they were like, oh, there has to be a way. And sometimes you have people with $10 in their wallet and they want to invest. And there's no way you can invest $10 in Africa. It's like it's difficult getting a brokerage account, and it's
Mhm.
becoming possible, but it's still not that easy. And that's when I think I was telling you, like, yeah, what is the idea of someone actually doing crypto? Because I've seen, if you walk around in like in Dar es Salaam or some big cities in Tanzania, you'll see billboards, people
Yeah,
trying to advertise on the crypto and stuff. So the awareness is there,
and
but
you were
the
even
opportunity.
mentioning the other day to me, I think that uh, they even have advertisements out like somewhere really remote parts of Tanzania. They have like Binance
Yeah.
Bitcoin like
Uh-huh.
advertisements. It's pretty crazy. Yeah.
Yeah, so Binance is like on the continent and these big cities and the advertising. And actually, like when you talk to college kids or college students, some of them already have like accounts and
Uh-huh.
they know how to, yeah, move money from the Binance and cash out and have this money going. So it's something that is catching awareness. And the piece that I feel is missing is okay, you can cash out if someone sends you money, or you can put money and wait for the appreciation of your crypto to actually happen. But what if you want to invest? What are the avenues for you to do crypto investments? And
Mm.
how safe can that be? Is there a platform out there that you say I can trust and invest? Yes, maybe there is, but how do you get that knowledge locally? That
Yeah.
is something that like has been of my interest. And I'm trying
Yeah.
to ask around on those crypto enthusiasts back in Tanzania or in Kenya, where I go often, or in Rwanda. Like, how do you guys use your crypto? most of them is just to pay for stuff. Yeah,
Yeah.
they want to order something in a given market where they can send the crypto and someone can receive it and cash out in their local currency and send them stuff. That's
Uh-huh.
how they're using it. But
Okay.
when it comes to investment, I'm not sure how much is actually
Are,
involved
are
in
are any of the, because I remember when I visited you in Tanzania, so you know,
it.
Mwombeki hosted me very generously for like 3 months or something like that. It was really cool, really cool. Such a
Yeah.
beautiful country, and my first experience in Africa. Um, and only one so far, actually. I would like to go back soon. Uh, but yeah, I remember like we were kind of like looking at these payments, and you were telling me how there are kind of this micropayment problem with the vendors, with like the street vendors, who
Mhm.
maybe they're selling you like juices or whatever small thing, and there's like all this like little change that ends up getting kind of being problematic because like people don't have the, you know, they don't have the change, so then now they're like running around like looking
Mhm.
for it, and then that was also in the context of like these payments like you know, like throughout the country, and like people sending money back home. Do you see any of those kinds of people kind of using it, or any of the like tribal people who are like who come and sell, like they sell stuff to the tourists, right? And then they go back to their village, like, you know, couple hundred kilometers, you know, back home. Do you see any of those kinds of people using it, or is it mostly like university educated people?
I think so. So I think you talked about the problem that we are trying to pilot back then. We were
Hmm.
trying to just maybe to give like a context. The idea was if you have like a big denominated note in the local currency would be like a 10,000 T shillings. You want to buy something for 1,000. The local vendor is supposed to give you change, and some of them do not have these small amounts to actually give you. So they have two options. One is to run around and ask around for someone with change and make sure they can break their 10K into small denominations for them to take their 1K and give back the 9K. Or the other option is to just tell you we don't have change and then forgo the whole sale. So miss the opportunity. And it's very common. You can ask anyone, it's not only in Tanzania, in any heavily cash transaction economy,
Yeah.
that is a challenge for most small
Yeah. It
vendors.
happens here too as well. Like you
Yeah.
get into a taxi, you want to give him, you know, whatever, some
Mhm.
pesos, and he's like, I don't have change. And then you spend 20 minutes, he's like running around, like asking
Running
his friends,
around,
like,
yes.
yeah, yeah,
Because they want to make a sale. They really don't want to run around, but they have to get that sale.
yeah,
Yeah.
yeah,
So,
yeah.
and I think that was the problem that we had seen. And our idea was we really don't want someone running around to give small amounts. Why don't they do mobile change, like send someone change? But there was another caveat that we had actually seen, whereby most of the mobile transactions are really expensive. The cut or the percentage in fees they pay, some of them is very high. So
Hmm.
instead of them giving you change on the mobile phone, they're like, no, no, I cannot do that. It's really expensive. So unless you're ready to pay for the fees, I'm not going to do that. And then automatically, if you bought something for 1K, you don't want to pay another fee of
Yeah. And
500.
just to add some context here, so like what happens in Tanzania is that like there's kind of like a cartel of like mobile cellular companies that are controlling these mobile payments, and the fees are ridiculous. They're like 5% or something like that.
Yeah.
Or they're just like very high. And so like if you're a small like business owner, like you're just not going to accept that cost, right?
Yeah.
Just you have thin margins anyways.
Yeah. So you'd rather pass it to the customer or just forego the whole transaction if the customer says, no, I'm not going to pay
Yeah.
this extra fee. So our idea was, now, how can we really enable them to do peer-to-peer transactions, like charge them so low because it does not cost us that much and actually make it happen. And I think we looked into how we can build our technology on a ledger and actually make it simple
Hmm.
for them to do that and all. And
Yeah, we were actually going to build out like something like our own blockchain almost,
yeah,
because we were thinking of using our own ledger,
yeah,
which is pretty cool. And we estimated the cost would be like basically almost zero to run that
yeah.
system. Like
Mhm.
a couple hundred months for like a couple servers, couple $100 a month for some servers, and the tech stack was like
Yeah,
pretty simple. Yeah,
yeah.
yeah.
Yeah, and then where I agree with David is that like most of the mobile money companies are like a cartel because it's difficult for you to get into that market. Getting a license to actually open, operate a mobile transfer business is almost impossible.
Hmm.
Wherever you go, they'll give you two options. Number one option is that there's a government circular that came out that says no any new entrants is going to be allowed because the central bank does not have the capacity to regulate anymore. And then number
Yeah.
two, they'll say, oh, you can go partner with a bank, a local bank, or you can go partner with a telecom company that already has a license.
Mm.
And if you go to these guys, they know for sure, no, this is their bread and butter, or they're controlling piece of business. They don't want anyone entering that, so they won't let
Yeah.
you. And
Yeah.
then when you go back to the central bank, they're like, why don't you open your own bank? Or we
Exactly.
need
Yeah. So it's like imagine being in the United States trying to do a business like some kind of business like this and being like, no, you have to create your own bank and open your own account at the Fed.
yeah,
It's just not going to happen, right?
it's not gonna happen. And you're like, no, I'm not trying to do like the whole endeavor of running a bank. What I'm trying to do is just lubricate the economy by allowing a small vendor to be able to transact. That's what I want to do because it
Yeah.
does not make sense for someone to pay 5% or 7% on a transaction fee for a small amount. I just
Yeah.
want to make it to be pennies. Like if you're sending this amount, I just want to pay you a platform participation fee. That's it. Let the
Right.
small vendor do business. They're like, no, but you need a license to do that.
Although, man, like we
Yeah,
we were so wild, especially with our idea of like owning the whole vertical, like in the healthcare thing, we were like, because we saw that there was also the problem with the middlemen in the hospitals. It's just like really hard to sell to hospitals. Um,
mm,
it's a very long sales cycle. So we were
mm,
kind of just like, hey, let's just set up our own vertical of like you were saying, like we'll buy the MRI machine, maybe some other machines, hire the staff, make deals with the radiologists and put our like superior software stack and we'll create a super nice experience for the patients and for everyone involved, right?
mm.
So maybe we should have started our own bank. I don't know, like how much does that cost?
I actually think it's not that much money if you're really into
I
running
think
a
it might
bank.
only be like, $100,000 or something like how much do you think it would
I
be?
don't remember very well, but I think it might be something like 5 billion. It used to be really cheap, but I think right now it might be like a 5 billion shillings, which is close to like $2 million, like a
Okay.
million 750,000, something like that.
Okay.
But
It's more expensive.
yeah.
Yeah, now. Yeah.
Uh,
Damn, we should have
the
done it
the
when it was
capital
only.
reserve used to be very low, but I think I don't have the actual numbers.
Yeah,
I'm
but is
actually
that
checking.
money can that money go to capitalize the bank or is it just in government fees?
I wish I would lie to you that I know all the details, but
Yeah.
I don't. But I
Let's
think
look into that. Like it would be so cool to own a bank. Yeah.
yeah, maybe we should find like-minded people who really see this as a problem and opportunity for business. We put down money,
Yeah,
establish a
man.
bank or telecom company, and what we do is
Because
just
the
we
thing
focus on
is
the
like
mobile transfer.
I think this is what kind of also it sounds like it's something that also inspired you to switch from medicine to kind of like med tech, which is that technology can like just make businesses so much better. Like there are all these dinosaur
Exactly.
institutions and dinosaur businesses still even today after like
Mm,
30 years of the internet that aren't doing things very well from a technological standpoint, and that reflects itself on the bottom line and with the customer experience, like so much,
mm,
you know.
yeah.
So like buying a bank and just doing it right, like and like maybe connecting it with crypto and stuff, like
Yeah, and so
it could work. We could make it work.
yeah, I agree with you. Like when you look around and some of these challenges, if you're a bank that is already making so much money, maybe in investment banking, retail banking is less and less appetizing for you. But if I'm just a new entrant and I'm coming in and I see that I can make enough money in retail banking, before I even focus on investment banking, I think I have an ability to actually customize on that one, be good in it, deploy massive technology and make it work.
Yep,
Now, I think like you probably already know, people are looking into like doing only digital banking. Like they don't need physical branches. There's so
exactly.
many people who hate going to a bank, lining up. You saw that in Tanzania or in other places where you just go to a bank, you have to fill in a form, you have to line up, and then when you go there, they tell you, no, your signature is wrong. You go back, you fill in another
Yep.
form, you talk to, like, there's so many layers for you just to transact like
So it's a horrible
$500.
customer experience.
Yeah, yeah.
I think with like a lot of big institutions, I don't know if they realize it or they don't care because they have this market power. Like half of the customer experience is the technology part. Like I took my son to the hospital a couple of weeks ago for like a scan, and it's the best institution locally. So like, whatever, best doctors and whatever. But I go there and it's like, okay, you have to pay for the exam before the exam. Oh, but you have to go over there. So I go over there and it's like, oh, but it's closed. Like the lady who does this like gets here at like 7:30. So now like go so so I'm like walking around and then I realize some like random person tells me, "Oh, you can actually go to this other like place where they usually like charge for like a different kind of service, but maybe they can help you." So I go there. And
Hmm.
yes, they're nice. Like all the people are nice, but their tech stack is like a mess. So anyways, they charge me, but they double charge me. And then we do the exam and it's kind of like an urgent exam. So it's like every day
Hmm.
shouldn't matter, right? It's like, oh, this gets
Hmm.
delivered in 4 business days. Okay, great. That's what it is. That's when the doctor
Hmm.
will read it. But then 4 business days go by and you don't get an email, right? Like no patient portal, like they say they have one, but
Hmm.
but they don't. And so then you have to go back there and it's like, and so that entire
The
experience,
experience,
like if I have a
yes, you
chance
don't get
between like two hospitals, one that gets that right and one that doesn't, even if the reputation is a little bit different, I'm definitely going to the one that gets that right. It looks like because it's much smoother experience.
Yes, and so it's the same thing when you talk about the mobile money transfer locally. Once, like, people have no choice. The only choice you have is your mobile phone operator and where you have signed. If you don't like what they do, good for you. If you can move to another mobile phone operator who has lower fees and has a much better service. But if you don't like your mobile phone operator, what can you do? You need to have a bank account where you can transact. And there's nothing like Venmo. There's nothing like an independent operator who's not a bank, who's not a telecom company, who can actually provide service. So these guys provide the service at their own leisure. And if you don't like it, okay, you can go back to cash transactions and stuff like that.
Mm.
So like I agree with you, like a small vendor or a small person who really cares about the experience, they'll not really want to go through all this customer service that we see. They'd want someone who ensures them that they can send their money, they can do business without thinking about fees, and if there's a problem, the technology itself can solve it. They don't need to call multiple people. Like you have this number where you call and they send it to another person, and this person says, "Oh, you have to wait within 72 hours for your money to come back," just because you.
Yeah, yeah, yeah.
Yeah, it's really
Now
fast.
compare that to the blockchain experience where
Mhm.
there's never a question where your money is. It's just all on chain. Um, it's permissionless. The only
Mhm.
problem is that there's like a knowledge gap, or kind of like I don't know. People use blockchain like natively. They had to jump through a lot of
Mhm.
hoops to kind of like figure it out and learn it. So that goes back to your earlier point of like, how are they, how do you like evangelize it and how do you package it for people to really massively adopt it?
Yeah, but we can use the same example with like mobile money transfer, how it started, where it is right now, and what's likely to be the next
Mm,
move. So it used to be on these character phones, okay? And before you could actually get your wallet on the phone, you have to go to like a vendor who is authorized to do that. They'll have to register you. You have to do your fingerprints. You have to like all these things that you have to do. And then after that, you really have to know the characters you have to type in. And so there is a learning curve that actually was really cumbersome for most people at the
mm,
beginning. But now you can tell like they've mastered that. People have
yeah.
mastered that. Some people are still struggling. But with the advent of mobile phones, smartphones, right now people have apps.
Mhm.
So you have like a mobile app that you can log in, just put in, select whatever you want, and off it goes. But it wasn't like that at the beginning.
Right.
So, and when you look into like right now, they're trying to make their mobile apps not only be for mobile transaction, but like an everything app. You can even buy a ticket. You can even for a bus somewhere. You can buy even a ticket on a train. You can pay for a concert and stuff. So they're bringing all these services within the app and doing that. So I
Mm,
don't really think adoption is going to be a problem longer than it is right now. So even for crypto or for digital currencies and stuff, I think it's just a matter of the technology creating a good user experience, and then the user will actually adopt. And
mhm.
some of the experience actually will be refined as users give you feedback. Yes, right now there are hopes to jump
Yep.
because not so much has been put into the user experience. But if you, let's say, if you create a platform that we want for the local non-educated user, then most likely your user experience has to not be equal to what you would create for advanced and other people. So I
Yeah.
think it might be a challenge right now, but given if I knew, let's say, David, if I knew I'm saving 20%, 30% or sending money on this platform versus the other one, I'll take time to learn the platform and how to do it.
Yeah, that's true. That's true.
Because
Yeah.
yeah, that's how business is. Yeah.
Yeah, and it's kind of like your point to how mobile payments started. It's kind of the same process. It's like you get the die-hard kind of early adopters who really
Mm,
need are driven but really by a need, and then as the UX improves, everyone else comes in to
mm,
get that same benefit. But the core technology has to, or the core need has to be very strong,
yeah.
and payments is a pretty strong motivation.
Motivation. Yeah.
Crypto, I think strong. Yeah, crypto is very much on that path, it seems like.
Yeah, and also you remember we were debating. Me and you were talking about the banked population. So if I was to bet my money where there's gonna be so much growth, if you were to really do like a digital banking or a digital mobile platform, it's where the most unbanked people are. If you can give my my aunt who lives like 1,000 kilometers from the capital city, the ability of them to have their money digitally, where they're not afraid of it being stolen physically, and then the ability of them being able to actually earn an interest on that money and make it easier for them to do it, they would invest. So you'd move them from the cash economy to the cashless economy much more easily than telling someone in the capital city who already has a bank account, has a mobile phone, oh, I have this other platform that you can use if the other one doesn't work for you.
Hmm.
So I think like yeah, so I think there is more opportunity where the unbanked people are, and they're like mid-tier or small-tier people, teachers. You have local fruit vendors. You have farmers. You have all these people who really want to do something to actually move them from the cash economy to the digital economy.
I
But
got
it
a
has to be
question.
cheaper and affordable.
Yeah. I got a
Yeah.
question for you though about the savings, kind of the savings idea or generating some
Mm.
investments. Are they, well, first of all, in terms of security, I'm assuming that if someone like robs your phone, then you lose all your money, right? No.
No, no, and yes. No, in the sense that unless they know all the PIN codes and the access to your wallet, then you lose your money. But if they
Gotcha.
don't know that, yes,
So
then
there's an
they'll have
app which is
to.
like protected by like some PIN code.
Yes. You have
Nice,
to log
nice.
into your app. You have to provide your PIN code,
Good.
and if you're the only person who knows the PIN code,
We
they
can
can.
implement that in crypto because like we can have a hot wallet app, right? But then it has password protected, which kind of decrypts the secret keys.
Yeah.
And so that's good. Okay.
Hmm.
And the second question though is that like so with this other project that we're kind of collaborating on now, we'll see like
Hmm.
where it goes, but we're developing these kind of like investment solutions on chain
Hmm.
that provide yield. Um, and you can imagine that kind of that primitive or that backend being represented or deployed, like in a UX, which is an app somewhere in Tanzania. But a lot of investments are going to be like either denominated in dollars or like in Ethereum or Bitcoin or something. Would people be open to that, or do they have to save in shekels?
I think one, if people can cash out where they cannot use crypto. Let's say I want to buy a car, a bottle of milk, and I have my money on my crypto wallet. If I can allow the local vendor to accept my crypto, I'll do that. If they don't allow me to pay in crypto and I can cash out and use the local currency, people will do that. So it doesn't really matter much how it's denominated, as long as the transaction where it's needed to
Hmm.
be used can
Okay.
actually be done. Yeah. So I don't
But
really
what
think
about the
that.
volatility? Like, the fact, let's say you're saving in Bitcoin or Ethereum, and there are just like a lot of price fluctuations with respect to the shekel. Are people okay with that?
Mhm.
And let's say you
I
can
think
cash out, but it's
I
still
think no
volatile.
one. I think any person with their money would not be happy with volatility, even if it was in dollars. If you knew that how much money you have today in your bank in USD, it's going to be worth what it is tomorrow, then I don't think you'll be happy. So that will be really strange if someone will say, "Oh no, I'm happy with my money losing value tomorrow because it's in dollars." Yeah.
Yeah.
So I think as long as people will understand the concept of volatility when it comes to crypto, when it comes to their own purchasing power for their own local currencies,
Yeah.
people
Yeah.
understand that. Yeah, but people have like I think the appeal that you have seen, for example, with Bitcoin and other cryptocurrencies, is the ability that people have seen that something that was worth $500 or $400 now it's worth more, and people are like, how? Why didn't I participate in that? But the
Yeah.
question is how? You had no means, you had no ladder to the
Yeah. Back then
platform
it was hard. Yeah.
back then together. And it's going to be the same thing in the future. Those who can actually invest their money with or without volatility will actually fare better than those who can actually keep hard cash and keep it under their mattresses and stuff. I think that's
Yo,
how I look
I
at it.
100% agree. And I think all the research and science and backs that.
Mhm.
But my question, I guess, is just that, how will customers perceive it? Are they going to be okay with that? Are they okay with that? Like, or are they like, let's say in a place like a country like Tanzania, do people prefer saving in shekels and getting, let's say, 10% return on their cash, or saving in dollars and getting 10% return on their cash?
I think so there are two kinds of people we're talking about now. Those who prefer to save in the local currency, Tanzanian shillings, and those who prefer to have forex that depreciates less and with means. So I think the way I would think of it myself, if people knew that the depreciation of their currency is much faster than the forex, then people would actually prefer to save
But
their
do they
money in
know that?
forex.
Do they know that?
Now, I think I think the knowledge of the market is not easily, and you never underestimate the knowledge of market. People will actually figure out, like
It's
when
just that
someone.
I believe in the intelligence of the customer. It's just that I
Mhm,
had an experience in Colombia where I was talking to a guy who's like a founder of it's not really crypto related. It's just these CDs. So like
mhm,
just a website where you can go and you can find where you get the best interest rate if you lock up your pesos
mhm,
for like a year.
mhm,
10%, 12%, 13%. And I was like,
mhm,
hey, what if I can offer you a product which is crypto based, but it's pegged to the US dollar and it generates like
mhm,
an 8%?
mhm.
And he was like, well, 8% is not as good as 12%. But I was like, but inflation,
Inflation is eating
right?
your money.
Yeah, yeah.
Yeah.
And so it's kind
Uh,
of, I noticed there that it's kind of an abstract, like everyone understands it a little bit, but it's also pretty abstract. And it's hard to get
yes.
past that sticker price of 12% versus 8% and
Because
think
of
in
the
terms of
8%
real
for one,
returns,
yeah, yeah,
you
real
know?
returns, yeah. I
So
think that's where you remember when I was talking about the UX that is in line with the user. So if you could do something like, let's say on your platform, you can compare and say, this currency of this amount buys you this good now, and this currency of this amount buys this good now. But 3 months before, this is how much of these two goods you could afford.
yeah,
People will know, okay, it makes sense for me to keep it in the other currency.
right.
So
So
the
they
purchasing
make like a
power,
really clever and easy visualization thing that just
yes,
teaches them in the
visualization,
moment.
yeah.
It makes it really
Yeah.
visceral. Yeah.
It makes it easier. If you told someone like, oh, a bag of rice actually, if this currency will get you a bag of rice, but it could actually get you 3 bags last month, and then you say, but the other currency here was able to get you 3 bags, and now it can still give you 2.5 bags. People are like, oh, so if I'd kept my money, I'm sure, like most of us, especially those who have like finance knowledge and stuff, like when you talk about depreciation, you think it's natural. But also, it took us time to actually grasp that concept when we were learning and growing and stuff.
Yeah.
And I'm sure, like even the local person, the moment you bring in the aspect of US dollars, the aspect of Bitcoins, the aspect of their local currency, all three in one platform, they would really want to know what it is. And at the beginning, it might be cumbersome for them to learn. But I believe with time, they will figure out. And if
Mm.
not, if you give them the easy understanding comparison that is in line with what you're trying to do, it can actually make it easier for them to adopt and understand. And it can
Yeah.
be as easy as comparing purchasing power for
Yeah.
something that they use day to day.
Yeah.
Yeah. Tell them day to day, get $1, get one crypto, get one currency. And they tell me, oh, this is how much you're buying it
Yeah.
of the same volume, yes.
Hmm.
Uh,
Okay.
yeah, I mean, it's
Cool.
a simplification now, the way we are talking about, because there's so many factors that could affect pricing. But at the same time, I think it's an easy visual understanding for a customer or for someone with not so good finance or financial literacy.
Yeah.
Yeah.
Yeah. Yeah, you got to communicate it properly and then just like, hit that right messaging and then it can grow. People educate. them, you know,
Yeah.
the one guy will educate his auntie will educate, you know,
Mhm.
the grandma, and like, yeah, it will spread. Yeah,
Spread and people will know. Yeah. Yeah, I
absolutely.
think the appetite for me for crypto or the cryptocurrencies and platform is just bring many people to be involved. That's number one, and then number two, get people the ability to invest where they cannot invest because the platform is not there. It's create that ability for people to come and actually say, I think this is good for me. But if
Mhm.
that opportunity is not there, people will never find out that it's good for them. Um, and people say, "Oh, it's so risky." And yeah, so much of everything is risky, but let people decide for themselves, given the knowledge that they have. It's not like you're trying to run this scam where you bring in many people. But if you see now governments, I think the other day we're talking about like the U.S. Government now trying to say, "Oh no, stable coins are the future." So even the U.S. government is coming on board, and we have other countries. I don't know saying, oh, you can pay in crypto and stuff. And so now how do you actually ensure that majority of those who are unbanked or are not on the platform actually come in and figure out for themselves? I
Mhm.
think that's for me is the appetite or the interest that I see in what we're trying to do.
Okay, okay, yeah.
Yeah.
So, so now I mean, you're based in San Francisco now. Uh,
Mhm.
you go back to Tanzania still, like pretty often, right? A couple times a year.
Yes.
Where do you see yourself in next couple of years? More in San Francisco, more in Tanzania? Um,
Uh, so I'm here with my family. I go in Tanzania actually every 3 months, 4 months. I go there for almost a month,
mhm,
because I still have those engagements and businesses operating. So I have to just go speak to the team and physically, although we do like daily or weekly meetings. So I go there very, very, very much. Once my family know where I will be, but I would prefer to be a global citizen. The advantages of being in the US and the advantages of being in Tanzania, but I still have an appetite for the African market. I think so much can actually be done on the continent, and the US offers a good opportunity for, I think, capital, talent, knowledge, and some of things that you want to do on the continent have been tried, or there's good literature or experience on the US side that you can leverage. So I find and I feel like I'm going to be back and forth,
yeah,
but I would really like to focus more on the African market.
yeah, it's a good mix. Me too. I consider
Mm,
myself a global citizen. I think
mm,
the U.S. has a lot of benefits and access to capital and expertise and so on. So it's
mm,
very good to be plugged into that, but then also look beyond it as well. Uh,
yeah.
if that's what floats your boat, and
Mm,
certainly, I mean, the kinds of problems you can solve in other places it strike me as sometimes much more interesting than the typical kind of like startup in the US, which is solving some
yes.
problem for like some
Mm,
first world problem. The problem, not problem, maybe.
mm. And I think also like uh, the challenge that you see in US and the challenge that you see in Africa, they are different. None of which is, I wouldn't say it's a good challenge or a bad challenge, but they're different challenges that can be
Mhm.
solved differently. Um, so I think both markets create their own different opportunities that you can tap into. So if we could have a platform that actually picks pace in US and picks pace in Africa, but addressing similar challenges is good. If it's addressing different challenges, but it's the same platform, that would be great as well.
Mhm.
If I know there are people with like, let's say, finances and money in US or in Europe or in Colombia in that matter, and they would really like to find opportunities to invest, but maybe the returns are not similar. You have much more returns elsewhere and different kind of risks. And I think that's the appetite that I have like a cross continent product or across continent market product that it can actually take advantage of different spreads of risks and returns as well. That's what I'm looking into. And I think the other strong appetite that we see right now, like with the advent of AI, so many challenges that we thought will not be solved in Africa because the local expertise has to be developed, the local talent has to be trained. Now AI can actually do it just like that. So maybe right now it's actually the right time to actually get in solving these challenges because you can crunch so much data in a very short time. And you don't need the local expertise to do that because the data is there and the AI can crunch it and can help it for you. So I think with AI, with crypto and the like 5G, 6G, who knows in the future, cheaper internet connectivity or Starlink and all these other avenues for connectivity, I think, yeah, soon we'll see more opportunities, business-wise, places that we didn't think they were because we could not reach them. And now we can reach them. There's data we don't have local expertise, but now we don't need it as much. But now we can take advantage of the AI to do that. That's the way, like I'm thinking on a very broader sense of
yeah. So like, so we're we're working on these AI portfolio managers on chain, like within crypto and stuff, and like you're getting involved in that too. But listening to you, I'm getting FOMO. Like maybe there are some more impactful things that one can work on. A little bit outside of the box, combining some of these new trends, like you mentioned, Starlink, AI, crypto, like something at the intersection of that. Quite interesting to set aside like every month some time to think about.
Yes, and I agree with you, David. Like, there's so much is happening in a very short time. In such a way, it becomes difficult for us to grasp on the context of which different machinery is actually moving. But just imagine this: a place that did not have internet connectivity now, in the near future, they're going to be able to get internet connectivity. The only caveat is going to be, can they afford it or not? That's number one. And then number two, you come into like schools and libraries and places in Africa that did not have enough data, did not have enough books and stuff. Now, with the availability of internet, they're going to be able to access almost the database they could not have. Now, just imagine that. Now, all of a sudden, there are some skills that we took for granted because you had your friend who could run Excel sheet and stuff. But now you don't need that. You just need a basic way of understanding your problem, putting it in a chatbot and asking the question, and it's going to crunch that number for you. In a small vendor in the village, they'll be able to do that. So there's so much that can happen. But on top of that, I think for me, the biggest challenge that I see is removing this person who's unbankable, someone with hard cash who does not know how to actually, they can make money, move on a platform where they can make money, bring them into a banking facility whereby it was almost impossible. Not every bank can open a branch everywhere because the economics of running a branch is very expensive and they don't have that time. But I believe like digital banking facilities are really going to be the future, where people will open their bank accounts, run their transactions, and do all the services without even walking into a branch. And where do you see more customers who want to do that? Where they are not banked as of now, and that's Africa and most of the Asian countries where banking is not big yet. So I agree. And the crypto ledger and the crypto technology it offers, but it's cheaper. It's cheaper really to move this transaction than it is on this traditional bank. So I wouldn't say that you're focusing on the wrong problem, but I would say more or less that we are focusing on the core problem, which is like finance.
I think so. I think so. I mean, I'm definitely happy where we're focusing. I think it's perfect, and especially this intersection of crypto and AI. But just looking back at my life and some of the opportunities, kind of like quote unquote mistakes, like I don't really consider anything really a true mistake, but just something, sometimes you look back and it's like there was an opportunity facing you, looking at you right in the face. You didn't see it. You were working there, you were dancing with it, but you didn't see it. And you didn't see it clearly enough to really like commit, like go full in. And I'm asking myself, like, to learn from that, like, what could I have actually done to have not made that mistake? And I think one of the things that I could have done, like, especially like when we were working on this like payment system for Tanzania, is had I been a little bit more open-minded and read more broadly. Like I consider that I read, I'm not illiterate, but read a little bit more broadly within that space and within related spaces, and taking a little bit more seriously people who kind of seemed silly at the time. And not been so focused on like what I was like building at that moment, like the technical, because there's so many technical details and shipping and this and that. And so maybe setting aside some time monthly to for more broader education and being a little bit more creative, I think would have helped me fully take advantage of some of those opportunities. Because like imagine if we had gone all in on that payment thing and said, let's actually start our own blockchain, let's raise for this, right? And really pushed it. I mean, could have been a big thing because it was very early. And
Yes, yeah, and I agree with you. It could have been a big thing. Maybe it can be a big thing in the
it can
future
still be a
still.
big thing for sure.
Yes,
Yeah.
but
Yeah.
you remember back then you had not visited Africa, you not visited Tanzania at all.
No,
So
no, no.
your understanding was more from a literature perspective, things you have
Yeah.
read, things you have seen on TV and stuff. And when you came in, I remember you remember when we went to do all the market surveys in the all the parts of getting on motorbikes and stuff and
Yeah.
and all
Yeah.
that. And you're like, you're so excited. I think there's no good knowledge like exposure to a problem you're trying to solve.
Yeah.
And and I remember when we did our Y Combinator pitch at the final, and the question they asked like, oh, so do you guys plan? Are you planning to move and live in the country for as long as it takes? And there was a pause. But if you had been in Tanzania before then, I think you'd have been, oh yes, yes. So
Yeah. 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 I was also a little too honest, I think.
which is good.
Well,
I mean,
yeah,
I'm
which is
glad
good.
you
Which
are
is good.
so,
Yeah. 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 Yeah.
yeah, which is good. Like you said something that was truly you, and
Yeah.
no matter the outcome of the pitch, but you didn't know better because you hadn't been. But right now, if we had to have an opportunity with an
Yeah.
investor and say, what do you want to do in Tanzania? Now your mind is clearly educated because you have
It's
seen,
very clear, yeah. And my answer still
yeah,
would have been kind of similar because my answer was like I'll spend like a good part of the year there, but
yeah,
because I also do believe in global citizenship, so like you know, but but it would have been yeah, it would have been much better informed and with much more confidence,
informed,
and I
yes,
would have told
yes.
them exactly why that's like sufficient, right? Like it's
Mhm.
yeah, but yeah.
Mm.
But
Yeah,
I
no,
actually don't.
no.
I don't have regrets about that. Like, but there have been opportunities like where things have been staring at you in the face. You maybe even had a similar idea and you just didn't go all in. And I think sometimes it's
Mm.
like, I think sometimes it might be a bit of a lack of knowledge and like not being broad enough. But also sometimes I think human beings sometimes wait for social proof before acting,
Yes,
right?
yes.
So you have this thing, you think it's big, but you're like, wait, why isn't anyone like
Doing
confirming this or
it.
like, like they're so relaxed about this, and then you're like, oh, it's probably not, there's probably some reason. And so then you relax too and you let it, you let it slip.
And then after some time, you realize, oh, I shouldn't have relaxed because I was in the right
Yeah,
path.
9 months later, like there's a
Yes,
multi-billion dollar company that does exactly that. So
same here. Yeah, but all in all, I think I'm excited and I still am about the journey that we took, all the experiences and the classes and the learning that we did, and much more excited about the future because the prospects of what we really want to do, it seems really good and very, very bright. So. Yeah, I
yeah.
love your reflection on on our past, and it kind
Yeah.
of removes all the blind spots on things that we actually should really consider now, given the experience. So
Yeah.
I'm with you on that. Yeah.
No, me too. I'm super excited about the future. I think we're living in an amazing time, just amazing
Mhm.
opportunities, like the birth of two major technologies and their revolution upon the world, which is blockchain
Yeah.
and AI at the same time.
Yeah.
And things like connectivity, like Starlink. I haven't
Hmm.
really even thought about that too much.
Yeah.
So it's just an amazing time, and I think like we have this kind of like patchwork of experiences, and it's kind of wealth that we should keep leveraging and sort of build it into some beautiful
Yes.
coherent thing. Like
Correct.
it'll all fit together at some point, and we'll realize why we went
We,
to the ghetto in Dar es Salaam to talk to those people,
yeah.
and then
Yeah.
other neighborhoods and stuff like that.
Yeah.
And it all fit together. Yeah.
They all fit together. Yes. Yes. So yeah. I agree with you. Well. Yeah, we have the local knowledge. We're in the right places. San Francisco is great. Colombia is amazing. We have understanding about Dar es Salaam, Kenya, Ethiopia, all these places that our initial investments, our initial engagements took us. So it's up to I think I agree. Like it's up to us now to actually now take advantage of all this massive explosion of technologies and do something. Because honestly, I think the world is going to change really, 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 really massive in a very short time. Yeah, like much faster. Maybe I'll say it's going to change much faster than it was changing before. Because all of a sudden you have tools that can do better than we could do
Yeah.
ourselves. Yeah, yeah,
All right,
yeah.
cool. Well,
Hmm.
that's Mwombeki Fabian. Thank you. Thank you so much for coming on. It was, pleasure. I think this is going to be an interesting episode for the audience. And yeah, hope you can come back on like in a couple months or something. We can do this again. Is there like some place people can kind of find you, contact you? Maybe like LinkedIn or some kind of platform.
Yes, yes. Yeah, thank you so much, David. This was really interesting, and I'll really do this again. Yes, people can find me on LinkedIn. I'm very, very much on LinkedIn than I'm on other social media. So first name, last name, one word on LinkedIn, you'll find me,
I'll
Mwombeki
drop the
Fabian.
link in the description of the video. Yep.
Yeah. And then, yes, let's meet and talk about more investment opportunities. If anyone is interested in fintech for Africa, we have experiences and some market surveys that we did, would love to share. If anyone wants to learn, kind of collaborate with us on crypto and crypto ideas, would love to hear what you have for us to do. Yes, David, and if there's any other opportunity for us to talk, I'll definitely come back on the podcast. And I had so much fun all this time discussing these ideas with you. Thank you so much for
Yeah, me,
inviting
me
me.
too. Just a wealth of experience. So it was
Mm.
really fun. Thank you so much.
Okay, thanks. Take
All
care
right.
and talk to you soon. Bye bye.
See you soon.